If the casualty is experiencing painful muscle spasms, they may be suffering from cramps. Although cramps are usually temporary, they can cause severe pain and are made worse by heat and dehydration. First, rest the casualty in a cool location. Gently stretch and massage the casualty's affected muscles. Have the casualty drink water or fluids and food containing sodium. Sports drinks, electrolyte pouches, and salty snacks all work well. Continue to watch the casualty for additional symptoms of heat injuries. A casualty may be suffering from heat exhaustion if they've been subject to prolonged heat exposure along with excessive strain and inadequate water intake. Heat exhaustion can be a serious condition if the casualty is not treated properly. First, move the casualty to a cooler location if possible. This may be as simple as giving them shade from the sun. Next, loosen the casualty's clothing, removing as many layers as possible, if feasible and appropriate. Actively cool the casualty by wetting their head and torso with water and fanning them. Orally rehydrate the casualty with fluids, especially those with electrolytes, like sports drinks. If available, cold fluids are best. Be careful not to let the casualty drink too quickly, or they may have difficulty keeping the fluids down. Monitor the casualty's airway and breathing and treat for shock. Place them in the shock position, on their back with feet elevated above the level of the heart. Evacuate the casualty if they cannot hold down fluids, get worse or become unconscious, or do not recover quickly. A casualty may be suffering from heat stroke if they've been exposed to heat for an extended period of time and have an elevated core temperature of 104 degrees Fahrenheit or 40 degrees Celsius, have an altered mental state, and dry, hot, red skin. Heat stroke is life-threatening and needs immediate medical attention. Immediately move the casualty to a cooler location and request professional medical assistance. Begin cooling the casualty by immersing the casualty to the neck in cold water, placing ice water soaked cloths or towels on the casualty, or placing ice bags covered in cloth or towels on the casualty. These should be placed all over the casualty's body, especially the torso and along the neck and armpits. Monitor the casualty's temperature every 5 to 10 minutes. Maintain the casualty's airway and breathing and treat them for shock. Continue cooling the casualty until the casualty reaches a normal body temperature, the casualty is evacuated, or medical assistance arrives and takes control of the casualty's care.